So this is virtual counseling, or teletherapy, or telehealth, or whatever you want to call it. But it's the lifeline that you're going to use in the next couple weeks to connect with your therapist and keep working on your mental health while we're quarantined or social distancing from the coronavirus. And I have to admit, it's not that bad. It's been a pretty positive experience so far. There's been a few internet glitches and a few problems, and sometimes someone's in their car, not driving, parked, because they need privacy, or in their basement, but I've been pretty amazed at people's creativity finding places to do their teletherapy appointments. And usually when I ask people how it was when they were done, they say it was actually fine. It's not a permanent replacement. I think the in-office appointments still have a lot of value, but for what we can do right now, teletherapy is a really great alternative. And I encourage you to try it. Most of my clients have picked up right where they left off. I even have a couple new clients that are trying teletherapy or counseling actually even for the first time. And teletherapy's worked fantastic. I really haven't seen a huge drop in the quality of therapy that we can do. I think the neatest thing so far is being able to see the insides of people's houses. It might sound creepy, but I've really enjoyed seeing how people live and how they decorate. It's kind of like this part of people that you never get to see by seeing them in person, and then you get to see this whole other side of them. It's been kind of neat. It's been really fascinating. I've enjoyed it. So some people have been asking, how do we do EMDR at home? And if you're not familiar with EMDR, check out some of my blog posts about EMDR. It explains it pretty well, or even just check out YouTube for what EMDR does. But for this, I'm going to show you how to do EMDR at home, so when you're doing teletherapy with your therapist or with me, you know how to do it. So EMDR from home when you're doing teletherapy. I'm sure there's other ways to do it. Some people do the butterfly tapping. I personally like this method where you put one hand on a knee and you move it back and forth. So it's like this. So you get the eye movements and some tactile feeling. That's how I usually tell people to do it. And then if they don't like that, we modify it from there, but that's where we start. And that's what you'll probably do, or at least start there. And that's the EMDR from home. And then everything else still applies. It's all the same stuff. We do body checks, deep breathing, what came up. It's all the same. It's great. It's fantastic. I've been super, super pleased with doing EMDR at home through telehealth or virtual counseling. It's been great. Hope you enjoyed this. Feel free to leave me some comments or some feedback about how this is going for you, or even if you're looking to start telecounseling or telehealth, let me know. Maybe we can work together. Bye.